Okay, this case is of a recreational soccer player who actually got an ultrasound confirmed tear in the mid-substance of the plantar fascia. I want to bring this case up particularly just to discuss treatment of particular layers pertaining to the plantar fascia itself. If I am going to release that tissue, there's several positions I'm going to treat it in order to get the layers going from superficial to deep. If I keep the knee extended in this position, therefore lengthening the gastrocnemius, it's actually going to apply tension to the most superficial layer of the triceps surae group as well as into the plantar fascia. So from this position here, if you come around here, when I take contacts, I'm actually going to utilize toe extension in order to draw tension into the most superficial layers of the plantar fascia, and my amount of compression and tension will differ accordingly depending on the layer I'm working. We also want to start to work the plantar fascia in dorsiflexion in progressive angles of knee flexion. Now, why progressive angles of knee flexion? That'll start to relax the overlying gastroc tissue and will allow us to sink, picture it as a little deeper into the substance of the plantar fascia, now keeping the toes at neutral, controlling into dorsiflexion. Even further to that, to get into the deeper layers, and now we're starting to get into the tissues deep to the plantar fascia, for example, the flexor digitorum brevis, we actually want to curl the toes up and then start to work dorsiflexion with the toes curled. That will effectively relax the overlying plantar fascial tissue, allowing us to get into the flexor digitorum muscle directly deep to it. Of course, these are arbitrary divisions because there is no such thing as separating completely from the superior layer, middle layer, deep layer, and the muscle underneath. But it just allows us to apply a little bit more compression before we take tension in order to fully release the tissue which has a considerable amount of thickness. The other thing you want to remember when you are treating plantar fascial problems, maybe not a tear like in this case, but perhaps just a regular plantar fasciitis, is the effect of hamstring tightness on the plantar fascia. If you have a lot of tightness in the hamstrings, which does not allow terminal knee extension during the swing phase of gait, that will cause more time to be spent on the forefoot during the gait cycle. The more time you spend on the forefoot during the gait cycle, the more of a tug effect you'll get at the insertion of the plantar fascia by way of the windlass. So the more forefoot pressure you put for the longer period of time, the more windlass effect you'll get, and the more aberrant tension or tug response you'll get at the insertion of the plantar fascia. So we're just remembering to release all of the levels, also checking that entire posterior chain, not just the triceps surae group, but moving all the way up into the hamstring muscles as well.